Dr. Bojana Jankovic, welcome back to the Plant Yourself podcast.
Thank you so much. It's wonderful to be here, and I'm so excited to talk to you today.
I am too, because you have been a voice of calm reason. Um, you know,
Thank
in a world like I'm trying to find information, and the people that I'm listening to very often are so sure of themselves, and I think are in danger of succumbing to confirmation bias, like looking for and then sending out information that proves their points. And you have just been sending out things that every time I read it, I just feel a little better.
Oh,
Uh,
well, glad to hear that.
so before we get into that, you are not unaffected by this pandemic. You just kind of tell folks a little bit about like what your life is like right now.
Absolutely. Yes. I'm a physician. I do internal and integrative medicine, and currently I am doing telemedicine from home, of course. I have two children who are 8 and 6.5 years old, so we're also homeschooling,
Mhm.
and we live in New York City, so we're right in the center of it. Um, and I think that as we were kind of chatting a little bit before we started recording, I really have to preface this by saying that I am so aware and so grateful for many of the things that we do have right now, that my family and I do have right now, and many of the concerns that have just been a little bit alleviated. Because we're not currently on the front lines and I'm not currently having to move. I mean, at one point I considered moving out and figuring out how can I volunteer and help and move out of the house and come back and in the end decided to make a decision for my children to stay. But I have to say that there are many, many things that I'm grateful for, but of course for all of us, even people that are not on the front lines, people that are not having to move out of their homes, people that have not lost their loved ones and seen tragedy and loss after loss and having to, you know, treat and comfort people that are dying without their family. I mean, um, of course, those individuals are the most exposed and the most traumatized by this. But I also recognize that many of us who are not there on the front lines, and certainly many of my patients and colleagues and friends that are not experiencing that day-to-day severe trauma, are in a way traumatized with these little micro traumas of, oh my gosh, what is going on? Am I going to get this? Is my loved one going to get this? When do I get to go back to work? When do my kids get to go to school? What does my financial future look like? And question after question to again maybe some of the more kind of good problem to have questions, such as is it safe to go on vacation this year, kind of thing. So there's a whole spectrum of um, both traumas and ways in which our existence right now has been compromised and shifted. And I think it's really important um, to acknowledge and allow for space for all of these, and then do what we can, and we can sort of get into that, but do what we can to help our loved ones in need and our community in need.
Yeah, there's a couple of things that you said that kind of triggered responses in me. One is I remember this book. I'm blanking a little bit on the title, but I think it was basically like How to Make Yourself Miserable by Dan Greenberg. And it was a sort of a comedy spoof book. And like the thing I remember from the book is the best way to make yourself miserable is to compare yourself to others, right?
Yes.
And boy, I'm seeing so much of that, and I'm certainly feeling it in myself. Like, who am I to be depressed right now when there's people who are food insecure and are
Mhm.
hungry, when there's people who are dying, right?
Yes.
When and so that I want to minimize my own pain.
Hmm.
And like, it shouldn't matter. I should just, buck up and be strong and go do my thing and not show any vulnerability. And of course, the result of that is not that I eliminate those feelings. I just take them out on people because I'm unaware of them. So I'm sort of making the world a worse place by not acknowledging, you know what? like honestly, I have been depressed for the last 3 weeks. I'm starting to come out of it through the acknowledgement. But if you look at like, do I have anything to be depressed about compared to most people? Like objectively, some part of me says no. And yet, so for you to say like, yeah, I have all these blessings and I'm still aware of my own and other people's pain without having to rank it or like, is this an ace over your queen?
Right. And honestly, I think it's so important to I totally hear you, and I struggle with this as well so much. And I think that two words that come up for me when we talk about that are guilt and shame, right?
Hmm.
Guilt, that sort of survival guilt, and that, well, it could be so much worse. I could be living with a loved one who has cancer and having to figure out how to move out of the apartment so I don't, spread this to them, or I'm in the front lines, or I don't have food security, or as you mentioned, so many things that are, I can't pay rent, so many things that are much, much worse than, again, for many individuals, the sort of drastic shift in lifestyle, but no impending, uh, threat to their health, to their shelter, to their food, and so on. And so I think that it's probably, and again, I'm not a psychiatrist or a therapist, but I would say that it's probably normal to feel those feelings of guilt and shame that many of us feel, that are like, well, I could be doing more and I should be doing this and that, and I should be getting PPE for everyone, and I should try to figure out, and I think that's valid, and that's probably part of our protective mechanism to kind of try to get us into that fight or flight and get us to act and maybe get us to do something that has meaning and value and purpose for us and for our loved ones. Maybe that's what it is. And so while I think it's okay to acknowledge that and to accept it, right? Because trying to push away or suppress any emotion we know is not effective. So while it's okay to acknowledge it, to also not let it sort of take over, right? And I think that it's perfectly uh, uh, natural, and many people are experiencing this of falling into a depression or falling into an anxious state or having a terrible insomnia because all of a sudden we're not feeling safe, whether that sense of safety is real or not real. It's real to us. We're not feeling well or we're not feeling safe. And so acknowledging it, but also being able to sort of question it and get curious about it and say, well, is that really true? And is there something that I can give and contribute, and provide meaning to? And is there a sense of comfort that I can create for myself that I can actually feel good about? And is that really wrong?
Hmm. Yeah. Yeah. And the other thing that really struck me was your decision to stay with your family and to provide telemedicine as opposed to like the call to war, right? I'm sure there's some part of your brain that says like, this is what I trained for. This is what I stayed up for all these nights to go to the front lines. And I think, for some people, you mentioned, I wrote these words down: meaning, value, and purpose. That if we're driven by meaning, value, and purpose, you will make a certain decision. Somebody else, like, Rob Ostfeld, who was working at Montefiore, will make a different decision, but they're both based on your meaning, value, and purpose of your life, as opposed to what I see, especially in a lot of doctors, is a savior complex. Like almost like, I have to sacrifice my family. I have to sacrifice my happiness. I have to sacrifice my own health because I'm only worth something if I'm saving the world. And I hear you coming from a much more mature and healthy place and saying that me being a mom, me being a wife, can coexist with me helping people. And in fact, from the place that I'm at, and I will testify to the value your communications and your interviews have given me during this time. Like, just because you're not firing howitzers at the enemy doesn't mean you are not valuably contributing to our society.
Well, thank you for that. It definitely And to go back to what you said, I 100% felt it was a calling. I mean, it was so strong. I decided, I put my name down, I volunteered, I went ahead and I'm like, I've got to do this. Like, this is my calling. This is exactly what you said. This is what I trained for. And now is the time. They need me. I need to help. And then in talking to my husband and explaining to my daughter, actually one night, I said that this was my intention and this is how, so I'm waiting to hear from the hospital and so on. And I will say, and I know that, if any parents who are healthcare workers or essential workers are listening to this, I think that we all know it's such a difficult decision. And I've read so many Facebook posts from moms and dads that are going in and not seeing their kids for very long periods of time. And it's just so heartbreaking to me. And so my daughter, who suffered from anxiety and now is actually doing much, much better, but just gave me this huge hug, and she was like, "Mommy, you can't leave. You can't leave us. Please don't leave us." And then just covering some of the practical issues with my husband, I've made the difficult, and I felt really, really horrible about the decision for a long period of time. I mean, I felt like I'm a total, I'm a total failure. I should be out there doing this and saving lives in this way now that it matters. But I think over time, I realized, okay, really, my family needs me right now. And there are many amazing, amazing doctors that have made the decision to go there. I'm going to work on doing the best that I can in this circumstance where I felt that I'm very much needed to my kids right now and my husband. And so, but it was really tough. And then, of course, doing everything I possibly can from my home office.
Mm-hmm. Right. So how do you feel now about that decision as you look back?
It's hard to say. I wonder. I really wonder what it would have been like. And I think that part of me will always wonder. Mm. And but I think it's also important to not necessarily get stuck on should have, could have, don't should all over yourself, right? But to, think about, okay, well, if and when the next wave comes, are there certain things we can do to prepare so that I can go out there? Are there other things or other ways in which I can continue to serve my patients, in this context of still being, a mom to my kids on a day-to-day basis, perhaps, And so I think that just sort of thinking about remaining flexible and thinking about being open to many different ways and possibilities of contribution down the road.
Mm. Uh-huh. Yeah, and it sounds like, you and I have talked a lot about mindfulness and about being in the moment. And it feels like you're holding the future pretty lightly. Like, yeah, these are possibilities, but I'm not playing chess with it. Right.
I heard, and we can dive in a little bit about what mindfulness is and how one might want to use it as a tool, because it's really a mind-body modality that has been so thoroughly researched, and there are many, many high-quality studies on it, on mindfulness-based stress reduction specifically, when it comes to improving our mental health and improving symptoms of anxiety and depression and coping, to actually even mindful eating, to help with binge eating behaviors, to also helping with some chronic disease symptoms such as chronic pain, or to help people suffering from other chronic diseases alleviate their symptoms and improve their quality of life. So what's interesting about mindfulness, and also for anybody listening, and Howard, I'm happy to share with you the link. I just listened to an incredible interview with Jon Kabat-Zinn that is directed. The one from this year was directed towards healthcare workers, and the one from last year was also directed towards healthcare workers, but a little bit broader because it was pre-COVID-19. Mm-hmm. But it was part of an online summit that is free. And I just was, every time I listen to Jon Kabat-Zinn or somebody who is in this mindfulness-based stress reduction space and so well versed and so well educated and science-based, but also open to the what comes out of awareness and what comes out of the non-physical, the non-measurable, maybe. I'm just so inspired, and I feel like it sort of takes me that extra step. So I don't know, perhaps what I said was inspired by something that I heard by, from Jon Kabat-Zinn, and sort of that my mind sort of had a chance to digest. But when we think about mindfulness, and what I really love about it is that mindfulness doesn't necessarily mean, okay, I'm going to meditate for 20 minutes today, and so I'm mindful. And now I'm a mindfulness guru because I've been meditating for 15 years every single day, and I'm super mindful, and I'm just like so mindful, and I'm great at it. And no, it's the opposite of that, right? Or, it's certainly not, okay, I'm meditating every day and doing these practices, and I'm Zen no matter what, and nothing. No, not that either. And not some sort of miracle or pill or switch or anything like that. And I love Jon Kabat-Zinn's definition because he, of course, founded the Mindfulness-Based Stress Reduction Program in 1979. And for anyone who doesn't know who Jon Kabat-Zinn is, he's actually a PhD in molecular biology from MIT, who has been a practitioner of Buddhism and mindfulness for many years. And he created mindfulness-based stress reduction as a framework.
Yeah. Before you go on, I just feel compelled to share one of my great shame moments of my life, which is related to Jon Kabat-Zinn.
Yes.
So
yes.
he wrote, there was a time where I was really struggling as a parent. I think my kids were maybe like 4 and 1. And I got his book called Everyday Blessings, The Inner Work of Mindful Parenting. And I'm on the bed reading it. And my daughter comes in and wants to tell me something. And I told her, like, get out of the, I'm busy. Can't you see I'm busy? And like, that's, if you had like a lowlights reel of my life, like that would be on it. Like me, basically swatting her away with Jon Kabat-Zinn's book on mindful parenting.
Right. And you know what? I think that's so true. I mean, I've done that so many times, like I'm busy right now. I'm like, whether it's reading a paper on mindfulness or preparing a talk on mindfulness, it's like, mommy's not available right now. I'm doing this, and just like, okay, I'm not quite embodying this right now. But what I really like about his definition and his framework is that it really is this profound awareness of where we are, what our present moment is right now, and of what's going on internally as well as what's going on externally. And the way that it's defined is that it's this awareness, this intentional awareness in the present moment without judgment. And so the interesting thing about judgment, of course, is that we all judge all the time. And that is our, again, survival mechanism. We have to decide, okay, is this, plant that I'm going to eat, does it taste good? Is it healthy, or does it have poisons or toxins? Or does this person that I'm talking to right now, does it look like they're smiling and they have good intentions and they're kind, or do they look like they're about to, hit me or something, right? So we have to judge. That is part of our human toolbox of evolution that was developed evolutionarily. But at the same time, when we think about being mindful, we're really thinking about creating some space. And that's the space between an action and our reaction to that, or a stimulus and our reaction to that stimulus. And so what I love about the practice of mindfulness is that really you can practice, like we are practicing it right now if we are connecting to ourselves, to our conversations, to each other, to people that may be listening, to the world today, to how just physically how we feel right now. That is part of being mindful. And so it's really something that we can practice 24/7, but at the same time, we're also human. So, and being human is not mutually exclusive from being mindful.
Right.
It's
Well,
that,
yeah. for me, the practice of mindfulness is not the being mindful, but becoming mindful. So without the human mindlessness, without the, I love how you talk about, like, when we're not mindful, there's no space between stimulus and reaction. And we're all conditioned, to, basically respond to whatever's happening in the moment to change our state to be more pleasant.
Right.
Right. So like candy is like cookies are a really quick, effective way to change my state in this moment. And as long as I don't realize it, I will keep doing all that. So the idea of coming into mindfulness is to recognizing, oh, here I am caught with my third cookie. Like, that's a really powerful mindful moment, as opposed to saying that I'm going to try for this 24/7.
That's a really good point. And it really is about moment to moment. And what's also really interesting, and I just heard again John Kabat-Zinn say this in this recent interview, is that somebody asked him, how do I get there? And he's like, but there's nowhere to get. Mm-hmm. And I just thought that was so simple yet so profound, because there's nowhere, like there's nowhere to get, really. It's really that moment to moment awareness and that moment to moment shift and that recognition of, like you said, with your daughter, recognition of like, oh, I just said that. Okay, well, I'll do better next time. I'm aware of that. Like, I'm aware that I just did that, as opposed to total lack of awareness and going back to your book, right? And so I mean, I have many of these moments too, of like, I remember I was in the car with my kids one time, and they also, and I think like those ages too are so hard, like 1 and 4, and my kids also were both toddlers. And we were driving, and this is when we lived in California. So we had a car and we were driving, and they were in the back of the car and just were so, and I was like, guys, just breathe. And, again, I was like, so, they were like fighting in the back. I was driving. There's nothing I can do. Mm-hmm. And I'm sort of trying to get us all to like take deep breaths. And meanwhile, my breathing is shallow and irregular. And again, I'm yelling. So I think that recognizing that, and even having a sense of humor about it, because again, it's part of the human condition. And I think that's what really appeals to me about the mindfulness-based stress reduction framework, is that realizing that there's nowhere to, like, truly accepting ourselves as who we are, and being aware of these different components of ourselves and our reactions and our triggers and the moment to moment presence.
Mm-hmm. Yeah. And like, I feel like I have been taught mindfulness in times in a way that actually made it seem very hard and esoteric and unnatural. Like, and I'm thinking specifically about mindful eating. Like, okay, I'll go to some spiritual day and they'll have lunch and I'll be like, well, I'm going to eat mindfully today. And then I'm like picking up the thing and like chewing 54 times. And it feels totally like performative, like I'm just doing a show. Whereas true mindfulness is much simpler and more organic than that. It's, it's almost like a bad term. Like, it's not your mind, it's your body. Like, am I in my body? Because my body can only be present. My mind can be a million years ahead or 2 years behind, but can I be in my body?
Absolutely. And I love that you actually made that point about the word mindfulness, because my understanding is that in many other languages, mindfulness is actually heartfulness. If you were to literally translate it, it's actually heartfulness. It's, again, we know profound connection between the heart and the brain, both physically, of course, but also sort of metaphorically, right? And so if we just act with our mind, right, that's our rational brain, that's our kind of calculated brain or maybe emotional brain. But if we act from the heart, it's an instinct. It is that true presence. And so, so I completely agree with you. I think that in a way, it's it's so much more organic and simpler than what we may make it out to be. And I think that there are a lot of, I really liked something that you said when we did the webinar together a few weeks back, which was about, the society making it so hard for us to make, healthy food choices and to be healthy. Well, it's the same thing with mindfulness. I think that the way that we've designed our lives today makes it so difficult to stop and have that gap between a stimulus and a reaction, to really be mindful. And I agree with you. I think that some of the mindful exercises when it comes to eating, they absolutely feel artificial. But I think they're there to illustrate one end of the spectrum where we're really just all consumed in this one act of eating a raisin. Like the raisin exercise is really well known in the mindfulness circles, right? And so, and I'll never forget when I first did my raisin exercise, because I didn't actually like raisins. I was going to get out of it. And then I think it was either in the Mindfulness-Based Stress Reduction Handbook or maybe John Kabat-Zinn's book, Full Catastrophe Living, in one or the other. They had something about, if you're thinking about not doing the raisin exercise, or if you don't like raisins, just, think again, just do it anyway and see how you feel. And I was like, okay, fine, I'll do it. And I'll never forget how in this moment of very much exaggerated chewing and smelling and looking at the raisin and really taking my time, my salivary glands, the explosion of that raisin's juiciness and I'm salivating now as I'm talking about it, the juiciness and the sweetness and is just something I will not forget. So it's interesting. Like, why am I still remembering this now? That was years ago, when I don't even like raisins. So I think it's to illustrate that. And then you sort of, go back to eating more naturally, but in a way that engages these senses, which again is so hard nowadays because most of us, again, myself included many times, probably less so during COVID because I work from home. So I can now just go and eat in our, kitchen or dining room and it's fine. But at work, I oftentimes will be eating lunch and doing work. So it is something that we sort of have to, again, take the time to do. Like, there are no shortcuts.
Right. And when I work with people on mindfulness and eating, I generally take two tactics. And I love your description of like the raisin, like you were getting real pleasure out of this food that you didn't like because you were paying such exquisite attention to it. And I think that like for a lot of us, we all know about the nutrients in food, right? The vitamins, the minerals, the phytonutrients, antioxidants, all that stuff. But it feels to me like one of the key nutrients in food is pleasure. And so if I'm doing work, which I sometimes do when I'm eating, I'm on the phone or listening or talking to someone else, or, even just sort of like eating on a video call and just like muting myself when I'm chewing, like I'm not paying attention. So there's none of the like vitamin pleasure getting in. And so, just like we have an amount of calories that we want to get each day, there's a threshold. There's an amount of nutrients that we want to get. There's a weight and a volume of food, and we don't achieve it, we're driven to overeat. I think that if we don't get enough pleasure, we're driven to overeat in the same way. So that when, maybe 4 raisins would be enough for you, right? But if you're eating mindlessly, I'm sure an entire box of Oreos isn't enough for most people, right? We eat until we're sick.
Absolutely. And that I have a weakness for chocolate covered almonds. And that is absolutely, if I compare really eating mindfully and taking my time and the richness of that flavor of that one raisin, if you truly pay attention to it, is so much greater than a chocolate covered almond but when I grab it, I'm probably also doing something else. And then it's just like, okay. And it's just sort of becomes this mechanical thing where I agree with you. If your attention is not on that, then you don't derive as much pleasure, even though, of course, the the pleasure centers in the brain after getting so much sugar are very much stimulated for a while, and we know that it's more addictive than cocaine or heroin. So it's there, it gets fired up, and hence the addiction to sugar. But I agree with you. I think it's quite possible that if you were to focus on just that and really savor it, then a smaller portion would likely suffice.
Yeah. And the other thing that people are not mindful about is how full they are. So very often people will come to me and the problem is like, oh, I'm eating the right food, but I'm eating too much. I say, well, how do you know you're eating too much? Well, I just feel bad. I feel bad afterwards. And but they, like I said, like, how full are you right now? Like if we had a scale of 1 to 10, like, oh, I don't know. Right. So until you look, you don't know. Until you pay attention to the salivary process around a raisin, you don't know. And so for a lot of us, like during the pandemic, I see a lot of people just stuffing themselves to feel better until they feel worse. And so, having the simple awareness of like on a scale of 1 to 10, if 1 is ravenous and 10 is as disgustingly full as I've ever felt, where am I right now? And what would trigger me to stop? Like, where is an optimal fullness place? Is it, maybe it's a 6 or a 7. And when people apply that to their eating, and it doesn't have to be like a full on meditation, but simply checking in every 10 forkfuls, it's like someone's pumping gas and they never, the gas is like pouring out of the gas tank and they're still fueling it because they're not paying attention.
Absolutely. I really agree with you. And I think that the other thing that's interesting is oftentimes I find that and again, with COVID-19, it's a little bit different, but if I find that I have something like somewhere to go right after that meal, I generally know that, okay, well, if I'm digesting, but then I also have to walk over somewhere or I have to get ready and my body generally knows that, okay, well, if I'm going to be digesting, I can't really overload my digestive system while I'm being active and, not that I'm going to go exercise right after a meal, but if I'm walking over somewhere, if I'm getting ready for something, it requires a little bit of physical activity to do that. Automatically, I find that I'm not going to eat as much because I know I have some sort of a light to moderate activity coming up. Or if I'm cleaning up the kitchen right after, I know that it doesn't feel really good cleaning up the kitchen with a very, very full stomach. It's like you want to not be a 10 out of 10. You want to I feel that I generally like to be maybe a 6 or a 7 at most if I'm going to be, loading the dishwasher, washing stuff, getting all of that stuff done. And so even just paying attention to what are you scheduling after your meal and do you have enough of a capacity to allow the digestive process to go on and optimally and are you feeling too full for the activity that you're about to do? But if your activity is being on the computer or watching TV, then it's easier to be fuller when you're not moving.
Yeah, and there's a little bit of a paradox seemingly there because you're talking about mindfulness, but you're also talking about future planning. But I think that the resolution is when you're mindful, sitting in front of the TV with an overly full stomach or trying to clean the kitchen with an overly full stomach, when you bring your attention to that and you feel how yucky it is, like as Judd Brewer says, it's the curiosity of those moments that are much better teachers than somebody's lecture.
Right. Yeah. And oftentimes, it's interesting because sometimes I think, and I'm curious to hear what your thoughts are about this, I think it's sometimes hard to be curious about those moments because they're uncomfortable. And so oftentimes we'll try to either say, well, I'll be better tomorrow. I'm not gonna, just really pay attention to this. I'll be better tomorrow. Or there's again associated guilt or shame, or just sort of suppressing whatever the emotion is related to that discomfort. And then that really is a lost opportunity to get curious.
Yeah. Well, it's very hard to be self-compassionate when you're beating yourself up. Like a lot of people, there's all these memes on Instagram about self-love, love yourself. When I am in a place of self-loathing, I just want to punch someone who tells me to love myself. Like it's infuriating. But if someone then says, "What does it feel like to be self-loathing right now?" Then they're asking a question that elicits curiosity. Like that can coexist. And curiosity is a very positive emotional state. So it's the one that can replace the negative, the loathing, the guilt, the shame that you're feeling in that moment, along with the profound discomfort. And it feels better than the self-loathing, and it can lead to compassion. So I think that for me, curiosity, which is kind of another word for mindfulness, like okay, I'm curious about me as opposed to curious about who did it on the police procedural.
Yes, and I think you're so right. I think you're so right about that, and it's I think what curiosity does, it just opens up that window of possibility, or that door of possibility. It allows us to question those beliefs and thoughts that maybe we've had revolving in our minds for a very long time, and now they're the norm. And we know neurons that fire together wire together. So this is our default mode. And let's say if we take, self-loathing, and if we take, beating ourselves up about something, that's our default pattern now. If we've practiced it enough, that's the path of least resistance. And so it's very, very hard to interrupt that loop of like, well, I never do this thing well, and I'll never be fill in the blank, or, or I'm always something horrible. And so that curiosity gives the opportunity to break that pattern and to say, well, is that really true? And at times we might feel that, yeah, this is true for me right now. And then we can follow up with the question of, well, have there been any examples in my life where this hasn't been true? And then you start that slow shift, which again, the idea is not to be the sort of always positive thinking and only positive things, but to expand our awareness to times in our lives maybe where we've been able to prove to ourselves that actually this false belief, this very negative belief, is not true. And again, that just cracks that door a little bit more open. Yeah. And then the possibilities arise.
Yeah. So I want to segue from there into your professional advocacy right now, because to me that it is also based on curiosity and a yes and attitude, as opposed to a no but, right? Like, okay, this is true, and what else is true, and what else could be true? And you're presenting webinars, interviews, articles, resources that are very curiosity driven. And I can tell they're curiosity driven because they are not strident, and you're not trying to convince anybody that you're right, you have the answers, and other people are idiots, which unfortunately is a lot of the energy of a lot of discourse. So you sort of share, like when you really ramped up your sharing since you've been home, since the pandemic. What are your goals in talking to your patients, and talking to students, to followers on social media, and to the world? Like what messages did you want to get out, even as there's so much we don't know?
Right. Yeah. So I would say, to kind of take a step back a little bit, just having been, trained in the conventional medical setting and having done research. I did cancer research. I have a master's degree that I got prior to medical school and in cancer research. I've always been data driven. Like that is just part of my undergrad was in biophysics. And so I have this huge interest in, again, data and statistics, numbers. How does this all connect? And then of course, being of a scientific mind, I also know that we can generate hypotheses, and then those hypotheses are either supported, not proven, supported by evidence, or they're not supported by evidence. They're rejected. And then when we look at hypotheses that are, let's say, supported by evidence, well, how strong is the evidence? How big was if it's a clinical trial, how many patients were in this trial? What was the design of the trial? What is the quality of the trial? And so on. Were there any biases on the parts of authors? And again, not to say that I'm certainly not an academic. I'm certainly, I'm not a researcher now, and that's not part of my current path, but having that so ingrained in me and really just being a core of who I am and how I think, this is how I approach anything that I read, whether it's from a medical journal or it's another source that's maybe citing some research or whatnot. And of course, now the range of research that we're getting, there's so much of it related to COVID-19, but the range of it is quite broad. There are a lot of non-peer-reviewed publications that are being made available, and a lot of studies that are being criticized and so on. So my objective really with all of that is to present information as I understand it objectively, and in a way that's easily understandable, but also practical and actionable when indicated. But also to keep in mind and to really keep it clear that I certainly do not know it all. And I'm very much aware of my own limitations, of our limitations of just scientific research in general. I'm aware of the fact that there are things we don't know. And so I think that it's so important. Yes, we like to be definitive and conclusive. And, of course, there are all these different motives for those things, right? But one of the very simple, I think, human motives is that we like certainty. We like to say, okay, 1 + 1 is 2, and that is it. End of the thing. That's it. But also we have to recognize that there is so much uncertainty. There's so much that we don't understand, not just in medicine, but in all aspects of science, and all of the really disciplines. And so my goal is really to share what we know and provide a framework for making the most informed decisions given what we have. Mm-hmm. And then for people who read that to perhaps take it to their doctor. Of course, none of the information that I share with individuals who are not my patients is medical advice. I still recommend that, of course, people discuss any changes they're going to make, any decisions they're making regarding their health. They must discuss them with their healthcare professional. But to be armed with the information and say, hey, doctor, what do you think about this? I just read this. Or to really use to guide their lifestyle. When we talk about some of the lifestyle recommendations and writings that I provide and that I put out there, and then some of the things that I do are really just because I'm a curious individual, and that's partly the reason why I went into medical school and did research, and so I'm curious to hear from other professionals and other specialists, and I'm often connecting with my colleagues over the phone, and a lot of the stuff, obviously, I'm not able to capture as a webinar, but I'm just curious to hear what other people think, what are other people working on, and I think it's so important, again, back to the curiosity, to maintain that and to really be humble, no matter who we are, to be humble about our current understanding and our current ability to provide guidance regarding a specific issue.
Yeah. So, the phrase that I wrote down from what you just said was like, what we don't know that we don't know, right? 'Cause like that feels so profound. Like there's things we know that are right. There's things we know that will turn out to be wrong. There's things we know we don't know. But there's this, like, those are all sort of definable. Like we have a sense of how big they are. But the things we don't know, we don't know. Like if you look historically at debates and whether in science or politics or society, it's those things that we end up looking at and saying, like, that's what they missed. That's what they got wrong. So how do you operationalize the fact that there's things you don't know when you're trying to come to an understanding and trying to be helpful to others?
Hmm. Well, I think that it can be very overwhelming, but only if we choose it to be overwhelming, right? So I think that to really answer it simply, knowing that what I'm what I'm doing right now is working towards performing to the best of my ability given the current knowledge that we have. And so I think that we all, as long as we know we're doing the best we can and really striving towards that and self-correcting when it's maybe not the best we can, that's all we can do. And then the unknown unknowns will, maybe some of them will reveal themselves over the course of our lifetimes, maybe they won't. But again, I think it comes back to the fact that we can only control the things that we can control. And then there's the rest of it that we just can't control. And the rest of it that we can't control, we acknowledge it, we recognize it, but we also don't necessarily dwell on it if with absolute certainty we know that there's nothing we can do to control it.
Mm-hmm. Yeah, so it's almost like the mindfulness comes back in when we're looking for narratives to wrap everything up neatly. Like one of the things I try to do, and I'm not that good at it, honestly, but what I try to do is before I start researching something or reading about something, I ask myself, what do I want to be true?
Mm-hmm.
Right. So if someone will post something about nutrition, here's a new study showing that keto helps with is healthy and helps with weight loss. Before I start reading it, I check in. It's like, okay, I want this to be wrong. So
Mm-hmm.
I know I'm going to go in there looking for, well, how big was the study and who funded it? And my bias is going to be to tear it down. As opposed to I see a study about isocaloric diets and the people who ate plant-based lost more weight and had better lipid regulation. I'm like, yeah, that one's good. Let me look and see, how I can promote this as brilliant.
Mm-hmm.
And and the problem is like when we don't have that understanding, we just fall into confirmation bias, and
Mm-hmm.
we then our egos are involved in protecting what we thought yesterday. And I see you doing a spectacular job of avoiding that trap in sharing things that feel like they are coming not from an ego place of I have to defend my what I told you yesterday.
Right, right. Yeah. And I think that really just comes back from that scientific background. But I agree with you. I think that even as scientists, we oftentimes can get uh, very much, we want a certain result. I mean, I know that when I was doing my master's research, I was really, really hoping for a certain result, and some of those outcomes ended up being statistically significant, and others didn't. And so and it's funny that you said that. Actually, I'm the same way. I definitely have a certain things that I'm like, I really want this to be the outcome of the study. I have to really check in with myself as to how I'm going to look at it as objectively as possible. Um, uh, and again, I think that, and we know, and I mean, I think you also alluded to an example that is just so confusing for most of us physicians and scientists and dietitians and health coaches, how to make sense of the literature on nutrition, because there are seemingly studies that have very different conclusions. So how do we reconcile that? How do we make sense of it? And I don't have a simple answer to that, but I know what I believe in, and but at the same time, I don't necessarily discredit the other areas, nor do I feel like, okay, I'm just in this camp here, but I'm not, and again, I think we've talked about this before too, and one of the things in my work with my patients, I certainly don't uh, um, impose strict what's the word dietary measures on my patients and say, well, if you don't do this, then forget it. How, I meet them where they are. But do I provide guidance in the areas where we know 99% of the research agrees on?
Yeah.
Yes, I do. And the simple facts that we know, like just the tiny number of our United States adult population that's consuming enough fruits and vegetables. Yes, we know that. Do we know that? And Michael Greger, actually, I was just recently reviewing some of his posts, who does nutritionfacts.org. Dr. Michael Greger, he was writing about individuals who don't consume any fruits and vegetables over a period of time, tend to have worse health outcomes compared to once they, start eating fruits and vegetables again, they do better. And then comparing the percentage of people that get upper respiratory infections or that are hospitalized for the flu, comparing those groups that don't eat enough plants and people that do eat enough plants. Well, guess what? If you eat more plants, you have a lower risk of getting hospitalized with the flu, according to this study, or you have a lower risk of upper respiratory symptoms, which again makes sense because we know about the benefits of vitamins, phytonutrients, and so on. So I think that I do my best not to pick and choose, but I also look for what are the commonalities? Like, what can I really draw from, or I can tell my patients, and then of course, depending on each individual's specific condition and predisposition and symptoms and so on, say, okay, well, let's start here. This is a reasonable framework for you, and then we'll work from there.
Great. So I'd like to end just by having you share, like, what do you know about COVID-19 that matters to ordinary people? Like, there's so much confusion out there. I hope that the course of this conversation has given people confidence that you don't have an axe to grind. You didn't like buy the t-shirt and now you're parroting everything the team says. So what should just practically, what should people know? What should they be doing? Masks, distancing, food, like anything you can think of that you have been sharing that helps people be safe and sane and happy.
Sure, absolutely. So in terms of, and as we all know, there's still so many unknowns and so many things about SARS-CoV-2 that causes COVID-19 illness that is going to be discovered, and so many surprises along the way that we've learned from our healthcare workers on the front lines, from how these patients are best managed and supported in the ICU, and how that's different from many of the other respiratory illnesses, and so on. So still a lot of questions, which I know, of course, nobody likes to hear. But then, of course, there was confusing information. Initially, we were told do not wear masks. Then we were told do wear masks. And so, I think that as our country starts to open up, I think it's still important to continue to practice the measures that people that they're able to really, as much as possible, reduce their risk of getting the virus or transmitting it. And so wearing masks is really thought to be one of the ways in which we can reduce the risk of spread. And I shared, I think it was earlier this week, an article that was written by Dr. Erin Bromwich from Dartmouth, who is an immunologist and a biologist who wrote about the different case studies of how COVID-19 or how SARS-CoV-2 spread. And what was interesting is that the most of the cases of spread occurred indoors, right? So thankfully, we're coming into warmer months, and so we'll be able to spend more time outdoors. And thankfully, it doesn't seem that the risk of transmission outdoors is nearly as high as the risk of transmission indoors, but we still need to be cautious. In terms of, I get a lot of questions about testing, and this is something that I wrote about recently as well. I think we have to be really careful about testing. The trend here in New York City has been that a lot of people are, getting the antibody testing. So we know, of course, there's the molecular testing, the PCR testing, that one can get from, initially, the gold standard was the nasopharyngeal swab, which is all the way back. Now there are actually some companies and labs that are doing the anterior nasal swab and also a salivary sample from the saliva to actually look for the presence of the virus. And that really just says that, okay, you currently have it. Whether you're symptomatic or not symptomatic, it means, okay, you currently have it and you could currently transmit it to somebody else. Now, what's interesting is that then we have the antibody testing, which tells us, have we been exposed in the past? The problem, however, with antibody testing is that it's not 100% accurate. It's not 100% sensitive and specific. And statistically, what happens is when we have a disease that has such a low prevalence, and remember, right now we're at about 1.5 million in all of US. The United States has 327 million people, so that's about 0.4% of the population currently has it. However, because of the lag in testing and many people not getting tested, some estimates are saying up to 5% of the population has it. So if we assume that only 0.4% of the population has it, then when we look at the sensitivity and specificity of the current tests that are available, when you get and specifically the specificity, actually, when you get a positive test result for the antibody, telling you, yes, you've been exposed, you have the antibodies, you may have some degree of immunity. Again, we still don't know to what degree we're immune, for how long, and so on. We may get falsely reassured because, and there's a great calculator actually where anybody out there who's like a math or statistics nerd, I'm happy to share. It was actually in one of my articles. But there's a calculator out there and that where you can play around with the numbers of, okay, if this percentage of the population has the disease, and if this is the sensitivity and specificity of the test, and all of these tests are published, on FDA.gov, all of the tests that have the emergency use authorization, you see that if the prevalence of the disease is very, very low, a test with specificity that's around 97 or so percent, if it's positive, it could be that it's more likely that it's a false positive than it's a true positive. Does that make sense? So
yeah. I've tried to wrap my head around this for years. Like I've known it and I've gotten like A's on tests with it, but really like understanding it. So let me try. So let's say there's a disease that only one person in the world has, and they've developed a test for it. And the test is like 99% reliable. Like if you have it, that if you test positive, then you have it. And if you test, so if you test positive, you have, but 1% of the time you'll test positive, but you don't have it. Okay. But only one person has the disease. So that means if we test 1 million people, then the chances of, and let's say the test, 1% test positive, the almost all of those people, so like 10,000 people will test positive but won't have it.
Right. Let me think. I have to get my pen.
Or maybe 10,000 is 1/10 of a million, or 1/100th of a million.
1/100th of a million.
So
right.
10,000 people will test positive, and only one of them will actually have it. Say. So even though the test, it says, if I say it's 99% accurate, I go, oh, that's pretty good. That's almost as,
Exactly.
But because there's such a low prevalence, that 1% represents the chances of you actually having it are very, very low. So you're almost always false positive. So the specificity of the test itself isn't a guarantee that it's right. It's a specificity in relation to how widespread it is.
Right.
And of course, the challenge is we don't know how widespread the thing is because we've completely messed up the chance to get testing, right?
Right, exactly. Yeah. So yeah, the specificity will still tell you what is the likelihood that this test is like specific to SARS-CoV-2 as opposed to another coronavirus from before. But then that positive predictive value is really what tells us, okay, if it's positive, what's the likelihood that it's the true positive? And so it's that positive predictive value that gets compromised if the prevalence of the disease in the population is very low.
Right. So you sent out an email telling people which tests, which antibody tests are reliable and where to get them. Do you think it's a good idea? Or, like what would somebody do with the results of the test either way? Like, yeah, I have the antibodies, or no, I don't. Like, would they change their behavior based on that?
That's a great question, and one we always ask in medicine, right? If you're ordering a test, it means that you would change the management of the patient based upon the result of a test. Otherwise, why order the test if it's not going to change your management or give you any further insight into how you may want to proceed with that patient's care? And so in this case, we're in a really tough spot. On the one hand, I think that especially in places where there's been a higher prevalence, in the regions where there's been a higher prevalence of COVID-19, or for individuals like healthcare workers that have been exposed much more so than the regular population, there is a desire to know, okay, well, have I been exposed? Do I have it? Not necessarily that it will change their behaviors, but in part to obtain more statistical information and to just understand more broadly on the population level, okay, how many people have been affected at some point during this pandemic? Of course, what's needed for that is that we be confident that whatever test we're using is gonna have a very high specificity and sensitivity, both. Because if we're trying to make accurate estimates of how many people have had it, COVID-19, we want to use a reliable test, of course. So
right. Well, reliability is a whole other issue, because like if we're doing research and I want to come up with like a reliable measure for depression or something, it's compared to what, right? It's like we say there's some reality that we already can measure. Like here, what are we even measuring against? Like, like how do we know if it's like, okay, it's 99% accurate in detecting antibodies? What are we comparing it to that's 100% accurate so that we know this is 99 and not 29?
Right. Good question. So the way that that these labs, when, I've looked at their monographs and how they collected data. So what they've done is some of them have samples from blood samples from pre-COVID-19. So before this virus emerged, presumably there was no SARS-CoV-2 in the world at all, right? So that's how you get that control population that for sure from these previous, from these samples that have been collected previously. Okay, these samples definitely should not have any antibodies to the virus because the virus didn't exist at that time. Now, people that are true positives in these studies of these tests of the antibody tests are the people who at one point or another tested positive for the PCR test, like for the actual virus. So they at one point or another had the virus in their body. So that's how they're able to measure, okay, we know for sure these people had it, and we know for sure samples of these people did not have it. And so that's what they're measuring it against. But I agree with you. I mean, it's still very tricky because, yes, we have the sensitivity and the specificity, but some of the tests, for example, even if we assume the prevalence of 5%, which is 10 times more than what is being reported right now, even if we assume that prevalence of 5%, there's some tests out there that if you get the test and you're positive, you may be 12% likely that your positive was a false positive. So with percent, if I get a test and I'm positive, but it could be that 12% risk that it's actually a false test. I mean, 12% is more than 1 in 10. It's not insignificant.
Right.
And
So
then,
if I go out there on the assumption that I'm safe and I'm not going to spread it,
mhm.
and so once we get this test, and now and you know, all of us go out saying, well, I'm probably not spreading it. We've just increased the spread by a lot.
Exactly, exactly. And that's the other assumption too, that even if a test is a true positive, and again, from looking at prior pathogens that we are able to mount immunity to, and we have these IgG antibodies to, we know that generally we should have immunity for a certain period of time. That immunity can vary. But the degree to which we're immune is still unclear with respect to SARS-CoV-2. And whether or not we may be able to get it again and transmit it, or maybe get it and be an asymptomatic carrier, we don't know.
Mm-hmm.
So even if it's a true positive, does it really change your management? At this time, we don't have enough data to say yes or no.
Mm-hmm.
I think for a lot of people, it gives them a peace of mind to know that, okay, I've had it, I'm likely okay for the time being.
Mm-hmm.
But it doesn't necessarily mean that we should just all of a sudden, loosen all guidelines for those individuals and say, okay, well, you're fine. You don't have to wear a mask. You don't have to. I think it's just still premature to say that,
Mm-hmm.
and again, we have to exercise caution. I think that when we're not sure, we need to err on the side of caution. That being said, though, I know that I've read that some individuals are being screened, before they go back to work. But again, does that really mean that they get to wear no PPE? And no, I mean, they still clearly should be taking the same precautions, both for their own sake and for other people's sake, even if they're positive. Even if we think, yes, they likely have some degree of immunity, this is just so new. And I think that that's what we have to kind of, again, trying to be not fearful about it, which I know is difficult, but just trying to be reasonable. Like, this is just the reality for the time being, and I have to take certain measures. So yes, on the one hand, it gives some people peace of mind. On the other hand, though, research is being done on convalescent plasma, right? On people who have had the disease, they mounted an immune response, and now their IgGs, their antibodies, are being used to study whether they can be helpful in the treatment of people who are hospitalized with COVID-19. So again, that's another reason why one may want to get it and see if they're a candidate for such studies. But in terms of making any real big changes in how cautious we are in our use of masks, hand washing, socializing in big groups, I don't think we're at the stage where we can say, yes, this gives you the free pass to do whatever you want. We're not there.
Got it. Right. So I think I heard exuberant children in your background.
Yes.
So I was wondering. I wasn't going to ask, but like, how are you keeping them quiet and occupied during this interview? But
so clearly they weren't quiet and occupied, right? So they were playing, but then I heard my husband too, and I was like, okay, I'll let him intervene since but yeah, definitely. I mean, they're in school, but now it's past their school day and past their school Zoom meetings. So they were, playing as a 6.5 and an 8-year-old sometimes.
Nice.
Very loudly. Yes.
All right. Well, it sounds like that's a cue to let you go and see what the damage is.
Yes.
So Dr. Bojana, thank you so much for showing, and for people who want to follow you. How can they get on your email list? How can they follow? Because as I've said, your stuff comes in and it informs me and it makes me feel better, even if you aren't sharing certainties.
Right. Thank you for that. Absolutely. So people can find me on drbojana.com, which is drbojana.com. And if they're interested, they can grab a free meditation guide. And I share a lot of resources on coping with stress and anxiety, really, practicing the health routines that are going to help us establish that foundation for the highest level of health that we can possibly achieve. So, and then I, do my best to share up-to-date information on what's current in health and medicine and wellness.
Right. And your videos are also well produced. Like my standard is, do I have food on my face? And your standard is like well lit. Like when you interview people, or you used to do interviews where you'd actually be in the same room, sitting on the couch with someone.
Right.
So high production value
Yes.
and great content. So it's a wonderful combo.
Thank you. Thank you, Howard.
All right, we'll say hi to everybody, and
For sure.
I look forward to when this is all, somehow behind us and we can get together in person again.
Yes, likewise.
All right. Take care.
Bye.
Bye.